Good morning everyone. Myself Dr. Tania Shah, working as a consultant pulmonologist in Tripura. Today on 5th June, we are celebrating World Environment Day, and I want to discuss about the largest environmental cause of disease, that is the air pollution. The effect of the air pollution on the respiratory health. The sources and the concentration of the pollutants in the air has been changing throughout the history as the society develops and the climate changes. We are seeing that the climate is getting warm day by day, and with this the air pollution is increasing, and with that different types of health problems including respiratory problems, cardiovascular problems, strokes, etc. are increasing in day by day. Today I will be discussing about the respiratory health effects due to air pollution. As we know, in the external environment there are many air pollutants which can affect our health. These are like sulfur dioxide, nitrogen dioxide, carbon monoxide, ozone, particulate materials. This can affect our respiratory health. The outdoor sources of these pollutants are like motor vehicles, which is the most commonest source. Also, there are indoor sources of these particulates like cigarette smoking, construction of the buildings, biomass fuel burning, gas stoves, etc. So, what are the health effects on the respiratory system occurs due to these pollutants? The patients who are already having chronic lung diseases like COPD, asthma, cystic fibrosis, interstitial lung disease, their frequency of exacerbation have increased due to this air pollution. Patient may develop upper respiratory tract infection, lower respiratory tract infection. We have seen where there is more air pollution in that area, in the children, there is reduced in their lung function and their lung growth. The patients who are having chronic lung disease, there is transient reduction of their lung function. Patient may develop lung cancer also due to this air pollution. So these are some of the respiratory effect may occur due to the air pollution. Now, what are the targeted population in the society who should be more concerned about this pollution? These are all, they are called as susceptible populations who should be well aware about this pollution and should take necessary precautions. These populations are the patients who are already having chronic lung diseases, elderly persons, infants, chronic smokers, and the patients who have post lung transplant. So these are the population, they are the susceptible population, they should be more aware from that of the general population. Now, other than the treatment, patients should, all people should be have some precautionary measurements before development of that diseases. As we know that the air pollution is increasing day by day, so we all together should maintain some control strategies for this air pollution. Now these control strategies can be in two ways, that is community oriented strategies, another is patient personal oriented strategies. Community oriented strategies, I want to mean that there are some government policies has already launched and schemes are there where to reduce the emission of the air pollutants are being tried. There is climate control policies are also there, which is initiated by the government. This help us to reduce the air pollution and the effect on the population. Coming to the personal strategies that should be maintained, like first of all we should monitor the local air forecast. So how to monitor the local air forecast? This is done by measuring the AQI. We can see on the road, there is in the side of the road there is some display board quoting that, leveling that AQI index of this level. What is this AQI? This is the air quality index. Briefly saying, If the air quality index is 0 to 50, then it is good for our health. There is no problem. But if it is more than 100 to 300, then it is considered as it is considered as unhealthy, and at that time the patient should be alert, mostly the patients who are already having chronic lung diseases. And if it is more than 300, it is considered as hazardous, and at that level all the general population should be aware. So by noting and by knowing that AQI index, we can be alert and we should monitor this AQI index, and it varies from locality to locality. After knowing that, monitoring the air forecast level locally, then there should be activity modification in personally to reduce the exposure to the pollutants. By not moving outdoors, by avoiding outdoor activities in that heat pollutant area, that using some personal protective equipments like N95 mask. Not only outside, the indoor environment should be also maintained clean. How? By using portable cleaning materials, by installing central cleaning system. In that way, we should maintain the indoor environment also clean. Other than that, some nutritional supplements can be used in aged patients, in chronic patients and comorbidity patients, like omega-3 fatty acid, antioxidants. In this way, we should take some personal control strategies to mitigate the effect of this air pollution exposure. So, in short, today I have discussed about the effects of the air pollution in our respiratory system and the susceptible population who should be well alert, and I have also discussed the control strategies that should be maintained. But after all, if you are having any respiratory problem more, then you should consult your nearby pulmonologist. In the last, I would like to end by saying that if you are well concerned about your environment and take precautionary strategies in advance, then you can stay healthy. Thank you.